As you know, trilostane is an adrenal enzyme inhibitor that's used in the management of the clinical signs of hyperadrenocorticism both in the dog and in the cat. Trilostane works by blocking the enzyme 3-beta hydroxynase. And what we see in trilostane-treated dogs is a rapid reduction in serum cortisol levels. The dosing recommendations for trilostane are as we typically start a dog at 5 milligrams per kilogram, and we start them once a day, and typically we treat them in the morning. We like to see the dogs then about 7 to 10 days after we start therapy, and at that time we perform an ACTH stimulation test. Now, one important difference between trilostane and drugs like Lysidren is that it's very important that we start the ACTH stim test about 3 to 4 hours post-pill. So if the animal takes the pill at 8 in the morning, we start our ACTH stimulation test at 11 or 12 o'clock. The reason that we do this is based on the studies that have been published showing that there's a good correlation between clinical signs and the remission of clinical signs with looking at suppression on the ACTH response test. We typically like to see their pre and post ACTH cortisols being less than 5 micrograms per deciliter. If we see that their cortisol levels are higher than that, we'll tend to raise the dose by 25% and recheck the dogs again in 7 to 10 days. Now, some of the recent papers that have come out, one from the University of California and one from South America, have looked at twice-a-day dosing of trilostane. And what they have found in those studies is that BID dosing is highly effective in treating the Cushing's, and the daily dose of trilostane that's administered to the dogs tends to be lower in the BID administered dogs than in single-day dosing. The remission of clinical signs, the appearance of the dog and the well-being of the dog, doesn't really seem to be any different, meaning that efficacy is roughly the same whether you're looking at once or twice-a-day dosing. So what we've been recommending with our patients is that we start our patients on once daily dosing and monitor them with the ACTH stimulation test again in 7 to 10 days. Where we've had to introduce BID dosing are in those dogs who have persistent clinical signs of Cushing's despite the fact that their ACTH stimulation test 3 to 4 hours post-pill seem to indicate good control. What we think is happening is based on the half-life of trilostane in the dog is that by 8, 10, 12 hours post-pill, you'll notice that their ACTH stimulation tests and their cortisol levels are rising back up again. In those patients, that's when we make the recommendation to go to BID dosing. And to go with BID dosing, what we do is we take the once daily dose that we were administering, divide that into half, administer that dose twice a day. We'll then have the animals return 7 to 10 days later for a repeat ACTH stimulation test. And what we've found in that scenario is that, again, we get good control of clinical signs with the BID dosing at a lower daily dose than what we were doing with the SID dosing. Typically, our recommendation at this time is that if the animal is well controlled clinically, you've got good control of the cortisols and good control of the clinical signs, we really don't recommend changing treatments. There doesn't seem to be any theoretical advantage to the pet if you're seeing good control. However, if you're not getting ideal control or if the dog is exhibiting side effects related to the Lysidren, then we do like to transition them to the trilostane. Our recommendation for transitioning is this. We'll stop the OPDDD. We'll wait 2 to 3 weeks and do an ACTH stimulation test. What we're looking for is to see that the pre and the post cortisols are now showing a response to ACTH. We would like to see the post ACTH cortisols in the 8 to 10 microgram per deciliter range or higher. If you're getting those kinds of results on your stim tests, at that point we'll institute therapy with the trilostane at the dosages we previously discussed.